Out of Miami with a scholar's mind. PSD, but it's still so kind. Cultural roots in the work is done. Teaching us how care is one. Okay, healthcare vision steady and strong.
Oh, Dr. Martha, I see you. Let me bring you.
Find your place, step in your field. Knowledge is power when it's revealed. You don't just teach it, he lives it loud. Kills up rooms and builds up crowds. Shows you how to move with grace. Lead with wisdom, own your space. It's office hours with Dr. J. Tuesday nights at 7, we're on.
Hey, Dr. Martha, I see you. Oh, I just muted you by accident. Hold on, let me. Okay, I see you. Can you hear me?
Hi.
Okay, perfect. Let me bring up the guest. Give me 1 second.
From the classroom to the life, he makes the culture feel alive. Teaching truth with heart and vision. As Dr.
PD, I see you. Welcome on in.
Viral moments, but still the same. Support the spirit, not chasing fame. In every room, he shows the code. Respect the space, uplift the host. Rules of engagement, calm and clear. How to show up, how to appear. Community over cloud or trend.
Aaron, I see you. Welcome on in. Dr. Michelle, I see you. Miss Crystal, I see you.
Every common intention will deliberate the blueprint for what it means to build online communities. It's office hours with Dr. J. Tuesday nights at 7, we're on the way. Trending topics, breaking it down. Bringing real experts into town. From the classroom to the light, he makes the culture feel alive. Teaching truth with art and vision.
I'm just trying to post it to my story. Give me 1 sec. Where's my board?
Onyx lens, black and gold. Melanin magic.
What's up, God? I see you, pals. I see you. Thank you so much for the repost.
Beautiful people shining bright. Professor by day, creative at night. Capturing legacy in every shot. 2 worlds, one steady flow. That's how real impact grows. Yeah. It's office hours with Dr. J. Building futures every day. Scholar, mentor, social guide. Leading culture with integrity and pride. From Miami roots to global reach. Teaching more than books can.
What's up, God? I see you. We're just waiting for a couple more guests. I'm going to get started shortly. I appreciate you guys. I see you.
Pure devotion. Pure devotion.
Let me send it up to Dr. Johnson.
From island roots to Miami sun, scholars mind the work well done.
Something you can use. I see you. Welcome on in. We're waiting for Dr. T. We're waiting for. I see you, Dr. Martha. Let me.
Okay, great. Thank you. Just messing with the settings over here.
Shows professionals where they fit. Hands them like says walking. Leaning. Don't miss the gem. Knowledge flowing in the room again. Tuesday nights at 7 sharp.
Okay, I got it. Okay, we working it out. Okay, you guys see me. I'm not a TikToker. I did it. Do you guys see my board on your end? Oh, God is good. Okay, we good. Okay. We're waiting for Dr. T. We're waiting for Dr. J. Give me 1 moment.
In every room, models grace, respect and honor shape the space. Rules of engagement clear and strong, teaching how to move along. Pouring into every voice. Keep showing up, that's your choice. Professor, mentor, entrepreneur.
Lady Red, I see you. Okay. Dr. J is here. Let me bring her up.
Doing it all, answering purpose every call. Step into the world he builds, where passion meets the skills, where students find their courage back. And professionals stay on track, from healthcare halls to creative life.
Okay, Dr. T, I see you. Can you? Dr. J, can you request up? I'm not seeing. It's not letting me. If you're able to, Dr. J, request up. Viewers. Or am I just not doing something right? Sub God, I see you. I see you. I appreciate you guys. I'm just trying to get everybody started. Okay. Perfect. Okay, we good. Who did that? Why is the layout like that? Should I, you know what? Should I take off the board? You guys, I appreciate you guys for coming in right on time. I appreciate you guys. I'm not really too much liking this layout, if I'm being honest. Give me a minute. Let me just think. Hold on. Give me a minute. Dr. T, I see you. Welcome on in. I'm taking off the board. Because it's like we playing checkers and we're not playing checkers. It's a serious conversation we're doing tonight. Okay, Sarah. I'm here trying to help out the people when they come in to see what we're talking about, but they see 6 professionals all together. You know what we're talking about. We're talking about the nitty gritty. You guys, I appreciate you guys so much. You guys are so busy. You guys are doing great work in the community and here on this app. So once again, thank you so much for taking the time to step into my space and just share your gems, share your informations. I know the people them are gonna love it. I know you guys are gonna drop amazing information. So I first and foremost, before we jump into it, I appreciate you guys all. Audio is still good. You guys can hear me? Yes. Perfect. Okay, so before we get started, you guys know we do. Dr. Johnson does his homework, and my panel did their home. I hope my panel did their homework too. So we're gonna jump right into it. For those of you who are new here, I am Dr. Johnson. Every Tuesday, I host office hours with Dr. Johnson. We do a variety of topics, healthcare topics, public health topics. I also interview a variety of other guests, and every month I host a panel conversation on a different topic. This month, today, it's July. July is also BIPOC Mental Health Awareness Month, and that's why you guys are here. And I have my BIPOC panel up here, okay? So we're just gonna jump right into it. Before we do, briefly, can you guys each share your professional and educational background? Some of you guys have been here already, so I know it's like a broken record, but for the new folks, can you guys briefly share your professional and educational background? This is social media, so whatever topics you don't feel like, whatever you don't want to share, we could all use context clues, but we'll go in the role that it is. So, Dr. Martha, we'll start off with you first. Professional and educational background, then we'll go down the line.
Hi, everyone. My name is Dr. Martha Pressinel. My profession here is I am a neurodivergent educational consultant. I am a former special education teacher. I obtained my bachelor's in broadcasting mass communications. My master's degree is in bilingual special education, and my doctorate, which I defended last year, is in instructional leadership. So thank you
Okay.
guys. I am so happy to be here with a panel of just wonderful professionals. I mean, we're all here with one goal in mind, and I think it's to spread awareness and to educate our people, our community. So thank you so much for the invite, and thank you guys for having me.
I love that. Thank you for sharing, Dr. Martha. Dr. Michelle, briefly, educational and professional background.
Good evening, everybody. I'm Dr. Michelle Francis. Educational background, bachelor's in criminal justice, master's in social work, doctorate in behavioral health. So by profession, I'm a therapist and also a forensic social worker. The criminal justice bachelor's came in handy now because I do work with the inmate population, individuals who are on substance use specifically. And then in my private practice, I work with an array of people. And I got my bachelor's and master's from Florida Atlantic and my doctorate from Cummins Graduate Institute. And I also became a doctor last year.
I love that. Thank you so much. Thank you. Thank you for being here. Miss Crystal, professional and educational background.
My name is Crystal. I'm a licensed professional counselor in the state of New Jersey. I have 4 licenses, so New Jersey, Delaware, Iowa, and Alabama. I got my bachelor's from Old Dominion University in Virginia, and that was in psychology with a minor in criminal justice. And then I got my clinical mental health counseling master's degree from Fairleigh Dickinson. I'm currently working full-time doing EAP services virtually, and then I have a private practice called Compassion Starts Within, where I see adults doing individual therapy. And I recently released a poetry book, so I am also a poet, writer, and love to integrate poetry as a form of healing with my clients.
I love that. Thank you so much for sharing that, Dr. T, professional and educational background.
Hello, everyone. Hello, host. Hello, room, and the wonderful panel. I am Dr. T. I am a doctor of physical therapy. I have been doing so about 14 years. I specialize in neurology, orthopedic, women's health, licensed with patients with Parkinson's. I do see children on the spectrum and some other developmental delays. I am over 2 clinics, outpatient clinics, where we do physical therapy, occupational, and speech therapy. And I just do so many other things. But thank you for letting me be here.
I love that. Thank you so much. And before I don't want to forget the reason Dr. T, she said physical therapy. This is a BIPOC mental health conversation. However, we're going to touch on the importance of, or the intersection of physical therapy, physical health, and mental health. So I had to bring in a subject matter expert. So I just wanted to make sure nobody was confused in the chat. Why is there a physical therapist up on here? Because your physical health can affect your mental health. Okay. So Dr. T, thank you so much for being here. Dr. J, your educational and professional background, please.
Dr. Johnson, we know how you do it, so
Mm-hmm,
maybe somebody's new needed to hear that, but we know how you put your panels together. I'm Dr. Catherine Jackson. I got my BA in psychology. I got my master's in human services counseling, and then my doctorate in clinical psych. And I went on to specialize in neuro. So I am a neuropsychologist. So I have all kinds of certifications, and all the work that I do is neuropsychology based. And I do a plethora of other kinds of things, integrating so many other types of wellness, which is why I love Dr. Johnson's space, because we don't just look at mental health, we're looking at the whole person and health as a whole. And I'm also the author of the book, The Couch Experience, A Guide to Good Therapy, and a whole bunch of other crap. So that's me
I
in a
love that.
nutshell.
I love that. Well, once again, panel, thank you so much for being here. We're going to jump right into it. Dr. Michelle, I want to start off with you, okay? Because I know with your work in this social work space, you work with diverse populations. And as we're going through these topics, you guys feel free to jump in, chime in. You guys know this is a collaborative conversation. Yeah, we might have our suit and tie on right now, but this is a collaborative conversation. So if you want to interject, if you want to add your perspective, please feel free to, okay? Also, a thumbs up or praying hands, that's me acknowledging you guys in the chat. I don't want to interrupt my guests as we're going through the topics and as they are speaking, okay? So Dr. Michelle, I want to jump right into it. From your perspective, okay, think about your social work perspective and the various communities you worked with. What are the biggest mental health challenges currently affecting BIPOC communities? You guys also, no right or wrong answer. There's a reason why all of you guys are here. We want to hear your perspective. We want to hear your experience, okay?
Definitely access to care.
Mm,
That might sound simple, but
mm-hmm,
that is the biggest challenge I experience. So, for example, if I have a private practice, unfortunately, I do not take Medicaid. A lot
mm-hmm,
of individuals who are BIPOC, they do have Medicaid. So that already cut off probably 50% of the people that I would like to service, but I can't. And it's not because I don't want to, but there's healthcare reasons why, and the low
right,
reimbursement. All of us went to school for a substantial amount of years, and we want
okay,
to be compensated accordingly. So unfortunately, access to care is very, very, I'm not going to say fully limited, because there are people who do have other commercialized insurance, but I do know that a lot of people who have Medicaid and who accept Medicaid, the wait list is so long. So by the time that they're able
mm-hmm.
to see a provider, they don't even want it anymore, or they just don't care. They're like, I might as well deal with whatever is going on in my life by myself. So I would say access is the biggest challenge.
Now, Miss Crystal, can you tap in? Anything you want to add to that, or are we good?
Yeah, I was just gonna say, I had an experience yesterday. I was trying to expand to get on to different panels because I
Mm-hmm,
have the licenses in other states. And the problem is that for a place like Alabama or Iowa, when and even Delaware, when I'm trying to get credentialed, you have to physically live in that state to
right.
be able to be credentialed with that, even if you're doing telehealth services and have a license for it. And so that does also decrease access where otherwise we could provide it if we have the space virtually to do it, but now it's going to be self pay or I have to try to refer you to somewhere else. And unfortunately, in those areas like Iowa and Alabama, having access to a therapist in that space and one that looks like us is limited. They're either overbooked, there's a waiting list, or they don't have access to get to them.
Exactly. Thank you so much for sharing that. Now I wanna jump over to Dr. J and Dr. Martha. You guys, the month of May, June, and July, we are talking. There's so many different awarenesses within those 3 months. Okay, starting with the month of May and then up until July, we are discussing mental health. Okay, Dr. J, how have conversations around mental health changed within BIPOC communities over the last decade? What would you say, and where would you say still needs some improvement?
I think more over the in the last decade, I think more people of color are open to accessing mental health care. So that was one of the major things that I've seen over the last 2 years, and slightly more too. I remember when I was an intern, how the waiting room where I did my internship was hardly anything, and I still do consult work at that place. And now start to see people of all races and ethnicities, people with all different types of religions, and it doesn't look the same all the time in the waiting room anymore. And then you asked a second part to that question, but I have lost it.
And where do you see opportunities for growth?
Oh, opportunities for growth is, and I think I said this the last time I came on for a panel with you, is that I think that the church is where so many people, at least I'll speak for my ethnicity, go, and where we look for help and where we look for mental health care, and we're seeking like to get everything in the church. And so where I see a huge place where we need to have more growth is to work with churches, and churches work with us, because I think a lot of us mental health professionals, we're okay with working with the church, but they have to be open to working with us too.
Perfect. Well said. Dr. Martha, I want to hear from you. How have conversations around mental health changed within BIPOC communities over the last decade, and where do you still see the need for improvements from your personal experience?
Sure. Yeah, so I agree with Dr. J. I think we've made a lot of progress as a community, right?
Hmm.
Black, Indigenous, I mean, it doesn't matter. I still consider us a community. I think people are talking more openly about therapy and neurodiversity now. We're having open discussions about it. And these conversations were taboo 10, 20 years ago, right? I think stigma still exists,
Yeah.
especially among older generations, where mental health struggles are often viewed almost as a personal weakness, I feel, rather than a health concern. This is not something that our communities are prioritizing,
Right.
specifically because of the stigma that is still against even neurodiversity in itself.
Hmm.
So I think having this platform, TikTok, right, social media,
Hmm.
these are our opportunities to spread information, to spread awareness, to share
Right.
research. So again, I appreciate what everyone on here does. I think what we're doing is we're setting the tone, right? We're
Right.
having discussions that weren't had before. We are inviting our people into these conversations because we too can handle these conversations, right? We
Right.
also struggle with mental health challenges.
Okay.
This is something that unites us as people. And I'm not, what I'm really trying to say is this is not only particular to people of color. This is
Hmm.
what unites us as the humankind, right? As the human race.
Right.
So I think having these conversations is a great place to start.
Hmm.
And you said, I know there was another
Oppor-
question, another part to
any
it.
opportunities for growth,
Our
improvement?
educational systems, for
Okay.
sure. I know
Okay.
Dr. D mentioned church. I agree with the church. I think it's limiting still because we
Hmm.
have so many opposing views when it comes to religion, right? So I think starting with our school systems, because there is a systemic almost failure that's happening across our school systems as we speak. Starting there is a great place to start educating our parents and educating our people again.
Right. Thank you so much for sharing that, Dr. Martha. Dr. T, get comfy. We coming to you, okay? There's a reason why you're here, so get comfy, okay? But let me tap in with my mental health professionals. Then we're gonna tap in with my physical therapist, okay, Dr. T. But thank you so much for being here. I want to talk to those who Krista, I want to come back over to you. We're always talking about, cultural competence and finding providers that look like you and sound like you, and the importance of making sure that the couch you sit on, you're pouring out your soul, your heart, your fears, everything to somebody who looks like you because they would understand you. Okay, Crystal, what does culturally responsive mental health care look like in your practice?
So in my practice, it looks like not assuming that because we look the same, we have the same experience. And so that means asking questions, being curious, allowing space for folks to tell me about their religious or spiritual beliefs if they have any. Also, talking about family dynamics, where they grew up, looking at their like gender identity. So, really getting a whole picture of who they are, asking them what their values are instead of, like I said, looking it from my own lens, and just being in a space of humility so that one, I'm also doing my own research and learning about it.
Hmm.
And then tailoring the different evidence based treatments to what we're dealing with without being dismissive of how that can impede with their like overall well-being, because sometimes those things that we say is evidence based doesn't really apply, right?
Right.
Or we have to tweak it so that it works for us instead of it invalidating or causing more harm.
Right. Thank you so much for sharing that. Before we continue, there's a question in the chat. I want to give it to Dr. J and Dr. Martha and Dr. Michelle. Can you guys touch on, or do you guys feel as though the DSM doesn't address generational trauma? I don't know if you guys saw that question in the chat. Anybody want to talk about that question or feel comfortable talking that? Or you know what? Yeah, there's a reason why we're all here. So we should all feel this is a collaborative conversation, no judgment here. So we should all feel comfortable to, touch on some subjects. But let me scroll back up in the chat. Touch on how the DSM doesn't address generational trauma. What would you guys say to that?
I
I,
think,
And
okay,
oh,
I can
sorry.
go. I think the DSM focuses more on individual symptoms
hmm.
and the way that they function, rather than actually diagnosing trauma as something that's inherited across generations.
Okay.
So while it's not a separate diagnosis in itself, it does affect, and obviously it could influence mental health outcomes and the way that people respond to stress and family dynamics, of course.
Right. Right. She nailed it. Anybody else want to talk about it before we continue? Dr. J, I see you.
I agree with Dr. P
Hmm.
with it. And somebody said in the chat that that's not the purpose of the DSM. And
Hmm.
I kind of agree that it is to identify different so we can separate what is actually going on. But one of the things that I do with trainees, training up and coming psychologists, is that one of the things I tell them to do is to get some additional training in trauma right away. Like, don't wait 5, 10 years into the career. Once you finish your postdoc to start to do that, because trauma literally is a thread, but into pretty much all the different diagnoses. I have
Right.
had so few intakes where when I'm asking about trauma, it doesn't come up for somebody in some form or fashion.
Hmm. Right. Okay. Thank you so much for sharing that. Thank you so much for
I would actually
dropping
want to
that gem.
interject
Sure.
there too. Yeah,
Sure.
because just having experience working in inpatient psychiatric, we're having folks having to get a diagnosis within the first couple of minutes of coming in the door, especially when they have not been stabilized. And
Hmm.
so even with that the diagnosis is tricky because you're doing this catch-all and not really being able to see any underlying things that can be causing the presenting issues. And so then
Right.
we have a lot of people who get misdiagnosed with personality disorders or bipolar disorder or schizophrenia when really it's trauma. And so there's a lot of even trying to like destigmatize how uh, a person is coming in a space and giving a diagnosis based on this book without
Right.
having a field view. So it's not just the book, it's how it's used and like the systems around it that makes us limited in being able to give a proper diagnosis.
Right, right. Thank you so much for sharing that. We're gonna jump right into the next segment, which is breaking mental health stigma. There's still lots of stigmas within mental health as it relates to the BIPOC communities. Dr. Michelle, we'll start off with you. Mental health stigmas remain a significant barrier to seeking care. Okay, what cultural, historical, or generational factors contribute to this stigma in BIPOC communities? No right or wrong answer. We want to hear from you.
Um, Definitely religion. I
Okay.
believe that individuals who are highly religious or religious leaders,
Mm-hmm.
they're not willing to partner with us, the
Mm-hmm.
clinicians, and that was
Mm-hmm.
talked about earlier. So culturally, that's one religion. I'm not gonna get too deep into that, but that's just that. And then culturally, some cultures still don't believe in mental health. So I'm Jamaican, and younger folks are eating it up. They want to go to therapy. They
Mm-hmm.
want to not repeat the same um, mistakes of our past, especially if they're having children and so on. They want to be better for the next generation. Whereas my parents and older, they have no interest in therapy. No matter how much we speak about it, like they have a clinician in the family, it's still like, oh, well, that's good for you guys. And I'm happy you're doing that. But no, I'm no interest. I will deal with it how I deal with it. So that's a stigma because if I'm like, no, we have to do this in order to break the cycle. And then on the flip side, the people who I come from, essentially, they're like, no, don't care. It's kind of hard. So it's like, what does the younger person believe? Like,
Right.
is the grandparents correct or is the parents correct? So I definitely think culturally and religion plays a huge role.
Right. Dr. T, I want to hear from you. You have the Health Hub, okay? And yes, you are a physical therapist, but you are also a health advisor for so many folks, okay? How would you answer this? Or what have you seen the majority of the people who you deal with, even some of your patients, what cultural, historical, or generational factors contribute to this stigma within the BIPOC communities as it relates to them seeking care or even seeking just mental health treatment overall?
Ooh, that's one of the reasons why I created the Health Hub.
Mm-hmm.
Because on Saturdays we do faith and healing. Can you
Mm-hmm.
trust God and trust professionals?
Repeat that again. Repeat that again.
On Saturdays on the Health Hub with Dr. T, we do
Mm-hmm.
faith and healing. Can you trust God and can you trust professionals?
Right.
And the reason why I created that space on Saturdays was because of what I see throughout my career of 14 plus years is I've treated clergy, I've
Mm-hmm.
treated non-clergy, I've treated 99 and up, I've treated, 14 and 15 where they're like, I got my therapist, no shade to our mental health therapists, but then you guys become their small gods and not necessarily the one who created them. And then you have our parents' generation who are like, it is a spiritual attack. Everything.
Wait.
Yo, you having diabetes is a spiritual attack. So we just need to pray it away and not change your diet and not take care of yourself. So it is, one thing I'm seeing now is I'm glad those generations are somewhat merging with panels like this and professional like y'all and like me that are speaking up. Even to my parents, I'm like, hey, I'm Nigerian. So we definitely don't believe in mental health. We believe go to your pastor. We believe you pray and you fast. We believe that, just don't talk about it and then nothing's going to happen because there's power in the tongue. So you talking about it means that you're giving light to it, which means that now you're agreeing with the diagnosis. But that's not what that means. That just means I'm educated myself. So I've seen that all around. And that's why I'm bridging this and saying, you can have God. You should have God. I'm a Jesus baby. You better have God. But you
Right.
also need these professionals because in the Bible, we have these professionals, right? He is our great counselor. So he believes in counselors. He had a physician, Luke, in his camp. So he believes in physicians. He had a tax collector. There's so many different professionals that were in there. So I throw the Bible back at some of my older generations and said, don't just read part of it. You got to read all of it. You got to know all the people's roles in the Bible. And then
Right.
they start, being a little bit more open. And our younger generation, I see them saying, oh, I can't breathe without my therapist. I'm like, no, that's not who
Mm.
gave you breath. But
Mm-hmm.
that's who can help you break down why you feel that way. But
Mm-hmm.
there's the one that created you above that actually gave you the breath. And now your therapist is helping you manage your breath. So I've seen it. And again, that's why I've created these two. I don't want to say they're not opposites, but they're really like this. And I'm trying to get each person to have
Balance.
a little bit of both. Yes, balance as best as they can get.
Thank you for sharing that. Dr. Martha, I
And
want
that
to hear
was
from
long-winded. I was
that was all
waiting to
right.
talk all this
I
time.
know I knew. That's why I tapped on you. I knew it. Dr. Martha, I want to hear from you. I want to hear from the Hispanic and the Latino perspective on that same question. I'll repeat it for you. Mental health stigma remains a significant barrier. What cultural, historical, or generational factors contribute to this stigma within the Hispanic and the Latino culture?
I agree with Dr. T. I think there is just a historical mistrust of any outside system, right? So educational system, healthcare systems. But beyond that, and beyond the cultural or religious aspect, I think there's this generational belief with like our older generations that emotional struggles and mental health and emotional well-being, this should all be handled privately. You know, in my house, we're not allowed to talk about these things with other people. You don't talk about this, you know, this is something that should be handled privately. It's a lack of discipline. It sometimes bounces off as a reflection of the parenting, which we know that is far beyond that. But that's how it is in my culture. It's grab a chancleta and beat the autism out of them, you know, until it goes away.
Right. Thank you so much for sharing that. We're going to continue. Okay. Dr. J, I want to hear from you. How can families, faith, communities, schools, and community organizations help normalize conversations about mental health? You guys know I'm always saying healthcare is collaborative. So when I did this question, this is a perspective of what I was thinking. That's how I would like you to answer it. You know, answer how you want to, but just to give you why I did that question, the collaborative effort. Okay. How can families, faith communities, schools, communities, and different organizations help normalize conversations about mental health? Because it takes a village. In anything you do, it takes a village.
And I'm going to talk about it with a broad breaststroke first, and then I'll try to break it down to some of the smaller ones. And ladies, help me if I miss a couple of these areas, because it's got a lot of parts to it. But the broad stroke is to me, if we talk about mental health the same way we do like our physical health, or even like our vacations or our hobbies, then we will start to break it down and normalize. So that's like the big umbrella part of it. But just like Dr. P had talked about earlier, I think we need to start within the schools, and we need to start not just with talking about mental health and emotions and how we deal with them, but also bringing some things in and having some kind of class. I don't even care if you call it zero, like they come in a little early or they stay a little late for it. Some classes on how to manage your emotions and how to notice the emotions. We don't give enough attention to it in school. It's so much academics. And so starting with the kids, by the time they get our ages or halfway to some of our ages, they'll already be so much better prepared. And I already kind of touched on the connection with church. Church needs to just work. Church and mental health needs to work together. It's not one or the other. And as Dr. T was kind of saying, you don't want one to seem like it's so high above the other. Well, God is God. So God is God. So I'm just going to say that. But you don't want to start putting one over another where you're not considering all the different areas of your wellness. So if your spiritual wellness is really high, and so it's God, you want your emotional wellness to be really high too. And so that's where the mental health therapists come in. And you talked about family, friends, and some other parts. I'm gonna let some of the other ladies kind of touch that one, because there's so many places that we could go for this. Like we could have been on a panel with you every Tuesday night throughout the month of July, just talking about just these questions that you sent. All of us too.
Did she nail it? Anybody has anything else to add? Did she nail it, or we can continue?
I just want to add one thing to that.
Sure.
Whoa.
Who is that? Dr. PD, I see you. And Dr. Rael, I see you. And Pastor Brian, I see you. You guys, thank you so much for being here. I appreciate you. I see you guys. Dr. P, take it away.
Just one quick interjection there. The more that we talk about mental health, the less shame that becomes attached to it. So it doesn't
Right.
matter where. I mean, if we want to do it at church, at school, in our backyard, on TikTok, on IG, Facebook, I don't care where these conversations are being had. But
Have
as long
them.
as we are able to provide a space where people can go and ask for help without the judgment, I think that's just the place to start. Just
Right.
providing that open space, that platform for people to come. This is already starting that conversation. This is
Right.
already a safe space where if anyone had a question, they can come jump in and
Mm-hmm.
ask those questions.
Mm-hmm.
So that's my take on it.
I
And
love
I
that. Thank you so
also
much for
wonder,
sharing that. Sure.
this just made me wonder, I'm just going to throw it out there. We don't even have to answer it, but how do we break it down like as a whole? Because then if you get to talking about your mental health, how that gets held against you, like at work or at schools or here. So that's just another part of that caveat of why I think the stigma just keeps going, because somebody will be brave enough to talk about the fact that they are dealing with different mental health issues, and
Mm-hmm.
it can be well managed. But then as soon as something comes up, that's the first thing that people will throw in their face. So how do we break that down?
I
Wow.
think
Okay.
that that's a powerful statement. Because just thinking about like working with folks in a space where they need accommodations for work, or they need, or they're dealing with issues with their kid at school, right? And being able to ask for accommodations for their child.
Yeah.
I've been a person who's been all up and through the school districts tearing up stuff because it's a lot of invalidation. It's a lot of, and especially when you are a child of color, a
Mm-hmm.
lot of the things that are actually mental health related are treated punitively
Yeah.
and are
Mm-hmm.
treated as behavioral issues, and then you're labeled a bad kid and you're given detentions instead of being able to seek, what is this, what is this symptom, right? It's more so like that's a problem kid. And then
Right.
because we have the generation above them not having that education, then it feeds into that too, right? So now everybody's on board with this is a bad kid. And I have so many adults when I'm talking about emotional awareness and being able to learn how to emote. A lot of times I wish I learned this in school. Why don't we learn this in school? And that's where it
Mm-hmm.
has to start, because we tell our families, tell our man up, be quiet, suck it up.
Yeah.
You just gotta, you just have to lock in, right? It's like if you just applied yourself a little more, or you're lazy. So a lot of those things making it a characteristic, like a character flaw, versus
Right.
you're experiencing a symptom. So now it becomes I'm a problem. And then that's how we move across. And that shows up as anger, irritability, because we don't know that we're feeling a bunch of other stuff. And so I do think it starts with like teaching the children, and then
Mm-hmm.
also integrating how now do your parents go support you when
Yes.
you're at
Right.
home. And so there's so many systems that if we all collaborated, it would be more impactful, because we can't just do it in one area and then dismiss the rest.
Can I add
Um,
something to that, Crystal? I
yeah.
mean, it was just so, again, you guys with your statements are so powerful. Like, we're going to be
Mm-hmm.
here forever. But
I'm
someone in
telling
the
you, we
chat
need to have
said,
us back every month, this whole camp.
therapy lady said, it's sad kids get labeled. And so I want to
Mm-hmm.
combine both of your statements, because this idea of this is the problem kid, this is that behavior kid, we all know what that's like, right?
Right.
Because that character flaw that we're describing, it follows them for the rest of their academic career. But not
Mm-hmm.
only does it affect them in school, now outside of school, this individual is carrying this response to trauma, because now I'm always going to be on the defense. I'm always going to be that bad kid, right? So I'm always trying to defend myself, which is where, again, that PTSD
Mm-hmm.
comes in, and the response and all of the mental health challenges, but it starts from childhood. And yes, our generations, our older parents, all of that interplays. But it's sad, now that we're talking about it out loud, to see how it follows them for the rest of their lives
Right.
outside of the academic environment.
Right. Right. Thank you so
Yeah.
much for sharing that.
And I think if we challenge systems more, right, you just
Mm-hmm.
using our voice, because I remember going to a town, a district meeting, and it was for the DEI, so for special education. And they talked about all the things they were doing to train staff.
Mm-hmm.
And it starts with just doing the trainings with the people in the board. And I'm
Mm-hmm.
like, that's cute, right? When
Right.
do y'all apply it now? Because that's not happening with the current staff and it's not happening for the current children. And so while it's nice to hear these ideas of plans, when do you implement the plan? And how do
Right.
we rectify all the damage that has already been done?
Woo,
Right.
that's powerful.
Right. 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 I think
I have
Dr.
a
T had
question.
something. Yeah.
Yeah.
Go ahead, Dr. T.
So I'm not a mental health therapist. Y'all know that. So I'm coming
Mm-hmm.
from the layman's,
that.
and I'm coming from another provider, right? And I think a lot of the education is for the children, but from my little experience, the parents, they don't know.
Mm.
They don't know when it is a tantrum. They don't know that maybe it's not a tantrum. We have to find a way to not make it so negative, right? We associate certain words with naturally negative, and so they expect. And when you expect something, right, naturally you're going to get it because you're
Right.
looking for that. So I don't know how y'all mental health therapists are going to do it, but we have to find a way where we associate certain words and not let it be negative. It doesn't
Right.
have to be negative. I have a toddler, and when she's overwhelmed and probably overstimulated and doesn't know how to really express herself, and yesterday she was crying in the parking lot because she was just, I was like, is her world over? But then she couldn't express to me that I really missed this, and I wish I had this. And I just sat with her and I just said, can I hug you?
Mm-hmm.
Normally my parents would have like, you're at school, you're not supposed to be crying. So we have to turn it around and train our parents or educate and associate certain words now in a positive light and not
Right.
so negative. I don't know how y'all gonna do that, but I need that, please.
Right.
I don't
Right.
know if
Thank you.
Dr. Johnson has a lot of questions, but there are so many different ways to kind of address it, but you can't,
Mm-hmm.
it's not a one and done. We'll have to keep having a conversation with parents. So like I think about when I work with patients on one-on-one or in groups, I say it one time and then I say it another time and then I say things another time. So that it really, because if you just say it one time, they're going to fall back to just all the other noise that they've heard and other things that they've learned. Sorry, Dr. Johnson, you
Right,
got
right.
questions.
I love this. That's why you guys are here. Brief pause. Everybody who is just joining on in, welcome to the BIPOC Mental Health Summit. Today I have Dr. Martha, I have Dr. Michelle, I have Dr. T, I have Dr. J, and I also have Miss Crystal. We are discussing a variety of topics. We just trying to wrap up the breaking the mental health stigma. We're going to be going over behavioral health and adolescence. We're going to be touching on the mind body concentration and the connection between physical therapy and your mental health. Then we're going to touch on how representation matters, which is why we're all up here on this panel. And then we're going to close it out with mental health maintenance and prevention. Okay. Dr. Michelle, I know you are pressed for time. You have to go at 8:30. So I just want to make sure you're able to drop your gems. Okay. But Dr. Michelle, what are some common misconceptions about therapy that you frequently encounter and how do you address them? I know you guys all going to have something to say, but let's start off with Dr. Michelle.
One, I would say that a diagnosis is a negative thing. I think that's a misconception because
Okay.
sometimes you do need it, especially
Right.
for, I'll speak specifically for BIPOC populations, that if you have a diagnosis, it's like, that's the worst thing ever. But more times than not, once you have the diagnosis, that helps us as the professionals treat whatever the symptoms, and
Right.
then that's the mental symptoms, and then it could also progress into physical symptoms. It shows up that
Mm-hmm.
way too. So I would say definitely that's one of the biggest challenges that I notice in general. And then unfortunately, if you're not fully private pay and you accept insurance, we have to put a diagnosis on file. So that's
Mm-hmm.
something I'm very cognizant about, informing individuals who are in therapy for the first time. Like, I do have to put one, this is why, and I talk to them about it, and this is what this means, kind of to lower their anxiety around
Right.
it. Because as we discussed earlier, some people, like, it does follow you, but it's not always a negative thing. If we destigmatize it, people will be more accepting that a diagnosis is not the end of it for you.
Right.
It's more so to help.
Right. Crystal, you good? Anything you want to add to that? I see you, Miss Crystal. No, she good. She nailed it. Dr. Martha, Dr. J, she nailed it. We good. We can continue. Perfect. Let's continue. Let's jump into behavioral health and adolescence. Okay. This is Dr. Martha's bread and water. Okay. We're gonna start off with Dr. P. What are the most pressing behavioral concerns facing BIPOC adolescents today? Let's start off general there. I kept it brief. I went into easy with you.
Let's see, anxiety,
Mm-hmm.
depression,
Mm-hmm.
social isolation of some
Mm-hmm.
sort, executive functioning deficits. That's where I see a lot of the where the support is needed. Really,
Right.
a lot of emotional dysregulation in our communities. What the cause of it is, I don't think we can put our finger on just one. You
Mm-hmm.
know, we can't say it's lack of education. We can't say it's lack of awareness, lack of exposure. It's got to be a combination of everything. And I think it was Dr. T, I want to say, you said something that stood out for me. You said parents just don't know.
Mm-hmm.
I like that because there is so much truth to that statement. How could they support their children in an area where they're unfamiliar? They just don't
Mm-hmm.
know. They don't know that there's something present there. So what exactly are they seeking help for?
Right.
So that's I'll leave it at that. Let's
Right.
have the other ladies kind of jump in and add to that.
Right. Right.
Not that Dr. P ever needs any extra on anything that she says, but I will just say to add to that list of different things that are facing teens, I feel like bullying, but it might have been encompassing another word that you said. Bullying
Mm-hmm.
is still so huge. And then I'll add the trauma that we all have talked about here today. Kids are exposed to way more. Just the having the access to the internet and not having being able to cut anything off.
Right.
I don't know everybody's ages, and we don't need to tell, but I didn't have all that when I was a kid, and so it was nice to be able to have whatever trauma or junk that was going on in school, and be able to go home and have a safe haven. I don't think they have that quite as much now. So that's the
Right.
only thing that I would just say. Some other things that I see facing teens.
Mm-hmm. Go ahead, Miss Crystal.
I would say, and excuse me if I'm repeating, but something that comes up a lot is, especially with the kids who have had to experience lockdown, and
Mm,
then reintegrating back into the school system, I did notice, my child included, that there was a lot of tension and a lot of chaos because now we're coming back together. We don't know how to communicate. We've
right.
been locked away for so long. And then on top of that, just with the evolution of technology and not having a lot of social interactions, just feeling awkward and having a hard time having one-on-one conversations, having a hard time being in a group. And so, like, when thinking about behavioral health with adolescents, it's already, prior to COVID, it's being able to communicate effectively,
Right.
right? And now, when you're facing the bullying and the peer pressure and the social media and all of the other things, now it's like, how do I communicate my feelings without being shunned or left out or dismissed in the schools? And then how do I get my parents to understand? So it's a lot of communication breakdown, and then it
Mm-hmm.
shows up as irritability, aggression, right? When
Right.
in reality they're dealing with a lot of anxiety, depression, low self-esteem, and turns into self-injurious behaviors and isolating. And so it turns into a huge problem when it can be addressed early on, and we have to be able to notice, like, what are those changes.
Right. Right. Thank you so much for sharing that. Ms. Mika, I see you. Dr. Martha, I'm going to come back over to you. Um, what signs should parents, caregivers, educators, or even mentors recognize that may indicate a young person is struggling? From your perspective, what signs would you say?
I would say isolation is one.
Mm-hmm.
If you notice that your child is not integrated, with
Mm-hmm.
other groups, that's already a concern on many layers, right? Because it could be a mental health concern.
Right.
We know that autism as a neurological disorder, it does impact communication.
Mm-hmm.
So it could be, again, something neurological, We don't know. But just that isolation is a concern because we want our children. And you know what, Crystal? I want to go back to something that Crystal said to add to this statement because she mentioned the pandemic. I feel like this happened and it's not a topic of conversation anymore.
Right.
We don't necessarily discuss how our youth or even our older generations have been impacted by it. But I remember that year because I taught virtually. I was still in the classroom. I was an ESE teacher at the time. And I remember when we started integrating the brick and mortar back. So our kids were back at the school. And when I tell you these kids came back almost like they were released from a prison cell, they didn't even know how to say hi to each other. It was this awkwardness of, do I wave? Do I hug? I mean, are we allowed to touch? And it was this discomfort that made it so evident how socially stunted our kids have been by the pandemic. So I think the first sign here is self-isolation for our kids.
Any other signs you guys want to tap on? Are we good? We can continue. We good? We
I
good?
would say just like subtle changes like sleep, appetite. If you're noticing like irritability or they're short tempered. So an adjustment from their baseline. So if you're not, oh, they've been a little off, like listen to that, tap into like, what does that off mean?
Right. Right. Thank you for sharing that. I want to come back over to Dr. Michelle and Dr. J. Dr. J, we'll start with you. How can adults create emotionally safe environments where youth feel comfortable discussing their mental health overall?
I feel like it's kind of like what I was saying about society as a whole. So if your teen or youth comes to you about something, you can't go into this like hyper parenting mode unless it's going to be like a safety concern. And allow them to share, listen, and then talk about how they could handle it best if it hasn't been, if they haven't already done it, or how they can handle something best if they've already done something and didn't handle it well. And it can't be punitive. They can't come to you and say something and then they get punished for it all the time. Some things is truly just a learning experience it's part of growing up. It's for you. They're going to make mistakes. They're not going to handle some situations right. They're not going to handle their emotions well all the time, and use it as a learning experience versus a time to punish and take away like all the fun things that they love.
Right, right. Dr. Martha, I have a question in the chat for you. I can have you take that one away. Ashley asked, what type of professional should I seek for my child to talk about their feelings?
Sure. I would reach out to your child's school. I would put it in writing if possible and just ask if there are any social groups at the school or any groups that may address your child's social emotional learning or social emotional feelings. Sometimes they have some, I don't want to say therapeutic, but they might have some social skills groups where they gather the children and they just give them, provide them an open space where they can discuss their feelings and they can share tools and strategies with them. So I would reach out to the school, put it in writing. They do have a set amount of days to respond to that notice or that concern. And now you're starting your paper trail. The goal is not to be combative and start a battle with the school. The goal is to be collaborative. You know, let's talk. What do you guys recommend? What do you have to offer? You're welcome, Ashley.
Okay, can I have two of my guest drop subject matter expert stickers in the chat? You see why they're here? Can I have my subject matter expert stickers in the chat? Dr. Michelle, I want to hear from you. What interventions have proven most effective for supporting adolescents or adults before concerns escalate into a crisis? We can start with you and then whoever else wants to tap in.
I don't know if it's an intervention, but more so meeting people where they are. I realize that's when I'm most successful, especially with the adolescents, like trying to speak their language. That is key for me. Like they come out with so much new things I don't know all the time, but what does that mean? And then they explain it, and then I start, communicating with them in that manner. So it's more so talking to them on their level, and I've been extremely successful that way. And also a little bit of self-disclosure, depending on where you're taught and your background. We have different we're a lot of us are taught not to self-disclose, but I don't believe
Right.
in that. I do self-disclose. I self-disclose if it makes sense in the therapeutic relationship, and more
Mm-hmm.
times than not, it does. So I say I'm willing to tell my client anything about me that I will tell a stranger, and
Mm-hmm.
if I have to go a little deeper. I do. Like, remember, these people are sharing like their deepest, darkest secrets with us.
Okay.
And to say, I'm not mute, I'm not stoic, I'm not bland in session. I like to be human with my clients. So I feel like the fact that I show up as myself and not a Dr. Michelle per se, but like Michelle a person, and they
Right.
respect me for my title. But I do say that just being human with them, that's the best intervention in my opinion. And that usually brings them, they keep coming back, and word of mouth and other people come to me because of that.
I love that. Thank you for sharing that. Anybody else wants to anything to add to that, or we can continue? Dr. J, I
I'm
see
just going
you.
to quickly say to what
Mm-hmm.
she said. I'm like you, Dr. Michelle. I will share what's relevant, and a lot of
Mm-hmm.
times that's my example is what makes it click for them. But what we do, what we do is that we'll share it, but we don't take over and make it an hour about us. So I just want to say that for people who are like, oh, here they go. They're just talking about them and taking over the whole time. We do not.
Right. Right. Right.
I'm speaking for
Thank
everybody here.
Thank you for sharing that. So you guys, so far we have had our opening discussion. We've gone over our section of breaking mental health stigma. We just wrapped up behavioral health and adolescence. Now we're going to get into the mind body connection, physical therapy and mental health, and how that intersects. Let's jump right into it. You know who we're starting out with first. Okay, so Dr. T, mental and physical health are deeply connected. Once again, mental and physical health are deeply connected. How do emotional health challenges affect physical recovery and chronic pain? Your perspective, we want to hear from your subject matter expertise.
We don't have enough time. We
Mhm.
don't, because I appreciate being invited to this space, because typically physical health is not invited into mental health because
Mhm.
they're so focused on their mental health. But to generalize physical health is getting people back to function. ADLs, activities of daily living, getting
Mhm.
up, getting out of bed, bathing themselves, using the restroom, brushing their teeth, walking, driving. Mental health is getting people back to function, getting their brain to connect to the physical. So rarely do we see this, but it is so deep. I feel like I am a counselor and I am not a counselor. And I
Mhm.
say that in every session that I have, I let patients know I am not your mental health therapist. I am a
Mhm.
therapist, but I am your physical therapist. You need to see a mental health therapist. You may wonder why some patients get better in 6 weeks, while some get better in 6 months. Now, there are comorbidities, different bodies, we're all individuals, but there is some similarities. It's our mental. Some people have the drive. Some people are
Mhm.
mentally there. Some people can understand. Some people aren't depressed, so they're able to motivate themselves. They need some encouragement, but not the full encouragement that they need. So in order for, if your mental isn't right, I can do all the exercises. I can do all the balances. I can give you all the experiences that I got. I can throw all my certifications to you. If your mental is not right, your physical cannot be right. A lot of people think physical therapy starts with movement. Yes, we are movement specialists, but guess what? It is the brain that tells those muscles to move. It is the brain that says, alert, alert, there's pain. There is the brain that it starts with the brain. And so
Right.
it's easy for people to say, oh, it's just physical therapy. No, it's mental health. There's so many barriers that we have to break down, so many. And really, it's connected so deeply. My sessions are 55 minutes long. So you
Mhm.
can imagine when they start talking to me, they start telling me they don't believe in themselves. They're depressed. Or even their signs and symptoms. Their high blood pressure, their heart rate is really high because they may be having a panic attack. Yet we think they're having a heart attack. Like there's so
Mhm.
many similarities.
Mhm.
I don't
Mhm.
think I'm answering your question, but I think we need mental health in order to be physically active.
Right.
If our mental is not right, I'm sorry, nothing is going to work. We need to get our here right as best as we can, if that makes
Right.
sense.
Right. Anybody else want to add, or she's good? We good? We can continue. Okay. Yeah, they leaving the physical therapy alone. Dr. T, I'm still on you. From your experience, how can collaboration between mental health therapists and physical therapists improve patient outcomes overall?
I think with collaborative health, for my clinic that I own, I do mental health in two different ways. My staff get 2 mental health day a year, or a calendar year, or their anniversary year, where they don't have to tell me why they're taking off. It doesn't count against them or anything like that. They just have to say they need a mental health day. For my patients, once we start noticing signs, I'm doing everything that we can to say, hey, you can do this. We believe in you, and we're just not getting there. We do have a section that we do refer to mental health professionals, because again, we can do everything. But if we don't have counselors on ground, honestly, we can't get through them. Ideally, it would be great if we were all in the same space where, a child or even an adult, I don't even want to use a child, y'all. I'm talking about my geriatrics, my 80 something that are holding on to things and harboring issues from back in the day and were never able to express themselves. And now they're seeing this generation expressing themselves. And now they're frustrated and can't really communicate. I wish I could have a counselor in my session to work on that part while I'm working on the physical part. So I don't know how we can educate like this and have panels where both professionals come in and say, okay, you're a counselor, I'm a PT. What collaboration can we do? How many how can we refer to each other, right? You see a patient that comes in with mental health issues, sitting in a wheelchair. Naturally, they need physical therapy. They also need mental health. You can refer. We can't get to our patients. Their prognosis is not getting better. We're doing everything that is evidence-based practice. We're doing all the new techniques. We're using the research, but we just cannot get through. We should be able to call up Dr. J, call up Crystal, call up Dr. Michelle and say, I have a patient who's not getting better, but according to my experience, they should be. I think there's a block somewhere else. Can I refer to you? Can you pause therapy? I need you to pause physical therapy for a while. I need you to go get your mind right. I need you to go work out that trauma. I need you to go break down those barriers. Then I need you to come back, because you're going to see that you're fully whole. So I think that referral, understanding what each other do and how we can benefit, and how at the end of it all, our patients benefit the most. So that's, to me, is how do we get panels like this? How do we have it more? So that our counselors can know to refer to PT and OT and speech, right? And vice versa, because we need it. And being okay with pausing treatment for the other profession so that they can come back.
Why? Because healthcare is collaborative. Dr. Martha, take it away.
I just want to add to what Dr. T said, coming from, again, the educational background, and maybe Crystal and some others will, and Dr. J, you guys might also agree. But as an IEP advocate, right, sitting through these IEP meetings, what we're constantly pushing is interdisciplinary support. We want OT to communicate with the PT, and the PT to communicate with the teacher, and the teacher needs to let the parents know, and then everyone needs to discuss the goals collaboratively. But as soon as this individual turns 18, it's like we're removing these supports and expecting them to navigate these complex systems alone.
On their own.
And the need for collaboration doesn't disappear when they turn 18. So 1,000%, I agree with you, Dr. T.
Right. Thank you so much for sharing that. Dr. T, I'm still on you, okay? So you spoke about traumas and anxieties and breaking barriers, okay? What should physical therapy providers recognize about trauma, anxiety, depression, or even chronic stress when treating patients?
That it's real, and it shows up in signs and symptoms. They don't necessarily have to tell us. If I'm watching your blood pressure, if I'm watching your heart rate, if I'm watching how you move, I don't want to say it's similar, but some of those signs and symptoms are similar. So being knowledgeable to say, okay, you know what? What are your signs? What are your symptoms? You're on the medication. You're talking to your PCP. You're taking it as required. It's supposed to be working, but there's something else, right? Being able to say, I'm sorry that you went through this. but can I help you speak with someone? Can I refer you to someone? Because what you went through is not normal. For me, I am the worst kind of your PT because I will pray with you, I will cry with you, I will call and make that appointment with you. You're not leaving my session without it. And
Right.
being bold enough to do that. That's why I left the hospital setting, because I was told I couldn't pray with my patients, because I was told that I couldn't send my patient to a therapist that I know could break down traumas, and I had to keep it in the system. But I know that they can't find the right person in the system because then they're pushed a certain way. But I need
Right.
somebody that looks like you. I need somebody that's been through what you've been through. I need somebody that you can connect with. And guess what? I'm going to do that. Because it's
Right.
not about the system. Yes, I want to keep it in the system, but it's about the patient. So
Right.
being able to be bold enough to say, hey, you got to get some mental health. This is beyond me. Knowing our scope of practice. If you know me on my platform, I said, I like to stay within the scope of my license. I love my license. So I don't step 1 second outside of it. And that's where mental health comes in. That's where that trauma comes in. I cannot break down your trauma. All I can say is, I am so sorry. But I am so sorry does not fix it. You have to see someone who's skilled at it. These women here are skilled at it. Go see them and being okay with passing the baton. Physical therapists have to be okay with it.
Miss Crystal, I see you.
Something that like from the therapist perspective, right, is when a client is coming into the space, one of the first things I ask, and I know probably everybody on this panel because of who we are, we're gonna ask like, when was your last physical, right? Because of a lot of things, a lot of times coming to treatment and anxiety, depression, those things can be mental health, but it also could be a symptom of blood sugar being off or thyroid, vitamin D. And so not having that blood work panel done, a lot of times we're not going to be able to just do talk therapy because it's something else. The other aspect with like collaboration is if they already have a physician and if they're already working on other things, is to getting a release of information, so that I can talk to the other providers so that we're all on the same page, making sure
Right.
we know what goals we're working toward in this space and what they're working on in others. And then recently, I've been working with folks who are dealing with a lot of medical issues, which comes with its own trauma. And then being able to go into doctor's offices or physical therapy or a gynecologist or whatever, and having underlying trauma means I need my provider to be trauma informed. And so part of that is, being able to have a conversation. I even offered this recently. I can have a conversation with your doctor about what would be helpful or what are some of the triggers, asking for a support person to be in the appointment with you. Being able to vocalize, hey, when we are in a space together, you can't come from behind. I need to be able to see you. And so there's a lot of things that we do need to have conversations like this so that we can support each other, because that person might not even realize I'm having a hard time in physical therapy because I feel triggered. And it has nothing to do with the person that's helping me. It's something that's happening within. And then how do we proceed that way? Because there are a lot of folks that will just come in and like put their hands. And it's like, I teach my folks about consent and having autonomy over their bodies. So if there's a lot of trauma that exists, they might not even go to those doctors because they don't feel comfortable enough to say, this is uncomfortable for me, or I don't like this. Can I see a different provider? So I do love collaborative work with other professionals, psychiatrists, physical therapy, any other medical professional that they have in existence, so that we can all be on the same page. And then also giving the client the information or education around what's your rights in those spaces. What can you ask for? Giving them a language so that they can advocate for themselves.
Right. Thank you so much for sharing that, Miss Crystal. TT, I see you in the chat. Thank you so much for being here. Dr. Michelle, I'm hoping that you can cover this question from TT. TT said in the chat, why do we feel health and wellness care are competitive as opposed to being collaborative? And anyone else can chime in after Dr. Michelle.
I think it's because we're taught to stay in our lane. So a lot of times we feel like, let's say it is the client does need to go to a physical therapist, but it's like I gotta keep. No, I only have to focus. I'm only supposed to focus on the mental, so I don't even touch that. It's like, okay, make sure you go follow up with a provider. But what I learned when I was doing my dissertation, the research shows that when it comes to referrals, about 60% of referrals that are sent, 60% of primary care providers do not have an up-to-date referral list. So most of the individuals, like you're getting a referral from your doctor and they're calling the provider, that number is either out of service, they
Right.
are no longer practicing, and so on. So what's super important here is that everybody on here have an active referral list for different providers that actually work, that you talk to. So it's one thing to say, like, we should collaborate, we should have the consent form to talk to them, but that's after. It's like, are we helping them find a provider, or it's after they find it on their own? So super important. So I would say definitely, like, we're kind of taught to kind of stay in our lane, but we have to be the ones to say, no, if I'm going to help this client and we're treating them holistically, we have to be the ones to kind of break that barrier and say, no, we got, all of us have to work together, essentially. So there's no competition. It's really not. It's more like a collaboration.
I
Right.
think that also goes into like the therapist versus the LMFT versus the social worker, and it's like, for me, if I'm in a space and we're at the lower level of the hierarchy of needs, and a client doesn't have housing, doesn't have food, like I'm going to help. I'm going to help you figure out what resources you need so that we can get to that next level. Or if you don't have access to a doctor, I'm pulling up my screen and we're researching doctors together. We're calling them together. And so it's like being able to be in a space where, like, yes, this is not like a therapeutic conversation, but it's where you're at right now. This is what you need. And so I'm going to help you get there versus saying, oh, go call a doctor. There's a lot of folks that it's like, duh, I know I have to call a doctor. I don't know where. Or
Right.
I keep getting told that there's a long wait list. And so being able to sit with them and help them navigate the system is helpful. And I'm not a social worker. I'm going to do social work stuff because we have to be able to address our basic level of needs. If we can't do that, then we're not going to be able to move forward.
Exactly.
I
Exactly.
agree
Dr. T.
with you. And
Oh.
you want to
Go
go
ahead,
first?
Dr. J.
Oh, because I'm gonna pull in something that you said too about like the collaboration, and Dr. Michelle as well. I think sometimes we don't collaborate, or some people, and I think it's a smaller amount at this point. It might have been more back in the day. But because we're afraid if I send them to Dr. T for physical therapy, they may never come back to me for brain-based services, right? But if they go to Dr. T and I notice that they need that and they're good enough and they don't have to come back to me, I'm okay with that. I know that there is enough out there for all of us. And then talking to Crystal with like what you were saying, like I feel like sometimes we have division in the mental health field where everybody's like, yes, social workers, this and that, psychologists, like, but I am team wellness. So it includes everybody. Dr. T for her physical therapy, anybody who's a social worker, anybody that works in the school, all those different things. We're not really in competition. Now, if it's social work, mental health, social work awareness month or week or something, okay, we're all going to be throwing up the celebrations for social workers. If it's the same thing for psychologists or for physical therapists or for school people, whatever, whoever, we throw it up then. But all this like hashtag team such as it divides us.
Right. It does. It does. Thank you for sharing that. Dr. T, I know you itching. I see you over there. You itching.
Sorry, just a little bit. I think for me, another great collaborative way would be if there was an appropriate screening tool that a physical therapist can have in their clinic. For example, whenever I do my intake, I can have a tool where it is not where I cannot interpret it, right? But it's a generalized tool. For example, we have one for speech. When I had my daughter and I went to her pediatrician, they would give us questions. That questions would allow us to take to the next step. If there were a screening tool that we could have to say, you know what, if a patient checks this and scores this, just a score. We're not interpreting, we ain't diagnosing. But if a
Right.
patient scores this out of this, please refer them to a mental health counselor. Not saying that that's the only time we should, because sometimes they may score perfect on that screening tool, but then, session 30 is when they're telling me that, they don't like people in their personal space. And I've been here this whole time and I wonder why they're not getting better. It's like, well, now you tell me session 30, I've been all in my hot breath in your face, right?
Right.
So it's like having a tool, but it's because there's not one way. And everyone is different, and how to connect with each person will be different. Some may do well with the screening, some may do well with just listening for the keywords, training us and saying, they may say, I'm fine, but maybe
Right.
fine now is a trigger, right? Maybe we need to look for those words that we can say, ooh, you're saying this a little too much. You're saying it jokingly, but it's not a joke. We need to get a healthcare professional or a mental health professional in. And Dr. J, you said the words right out of my mouth. We are so fearful of losing. I put money in the chat and I think TikTok filtered it. And I answered Tita and I said, money, money, money. Because we think we're losing and we're losing the dollars. And it's like, you're not, because you send a patient to me, they get better. Guess what? I'm thinking about you. And I'm like, oh, she can help all my patients. Oh, I need you to go to Dr. J. I need to come back. And you know what? Don't even come back right now. Go get it done, right? So
Right.
being there, I think you touched on exactly what I was going to say. So I'm on mute now.
I want to
Right.
add to that too.
Yes.
I know we talked about church, right, being one of those opening places to have these discussions, but back to schools. I feel like we often expect teachers to be the first to notice when a child is struggling, whether it's mental health or emotional health or learning disability, right? But going back to these same school systems, they are the ones receiving limited training in recognizing even something as simple as signs of ADHD, autism, anxiety, trauma, learning disabilities. I mean, or whatever other developmental concerns there may be, right? So
Right.
I think if schools want early identification and interventions, then we need to invest some money into our teachers. We need to invest
Hello.
money into our educators. Educators
Hello.
need access to ongoing training. They need a clear referral pathway so they know who to call. Dr. Michelle said providers don't even have a clear referral list. What are teachers supposed to do? If a teacher
Right.
notices that a child is struggling with mental health, okay, they're going to go to administrator. Administrators don't have time to track every child that is claiming that they don't want to be here anymore or that they're bored because of their homework. So again, community resources and investing money back into our school systems so that teachers know exactly what to do and identify it with the tool that Dr. T was referencing
Okay.
before. And now we have a system. Now we have somewhere
Right.
to start.
And I don't
Exactly.
remember which lady said it here before, but not just the training, Dr. P, but how to, so that they can actually implement it. I can't remember if it was Crystal or Dr. Michelle or both of you, but people get all these trainings. I can't tell you how many trainings I've set in on, and I know all of you have too. But then I want to know, how do I implement it and put it into place right away? And that's the
Right.
only way we're going to get the change.
Right. Right. I love that. Thank you guys so much for sharing your experience and your opinions overall. Quick recap. We've gone over breaking the mental health stigma. We've gone over behavioral health and adolescence. We've gone over mind-body connection, the physical therapy and mental health. And we are about to get into how representation matters. For the sake of time, Dr. Michelle, I'm going to have you lead us on this one. Okay. So why is representation among mental health professionals important for patient engagement and outcomes?
Because a lot of times, some patients don't, because of the stigmas that we discussed earlier, culture and religion and so on, if the provider looks like you feel more comfortable. And I'll speak for myself. The first therapist that I had did not look like me, and I didn't feel comfortable, and I didn't go back after one session because I expressed something that was going on, and they were like, "Oh, it's not really that." Kind of like dismissed how I was feeling. So I was like, I'm not going back to this lady. And I didn't for a long time. And I know I should have, but I didn't. And then finally, that was before I was fully a therapist and knew all that I know now. But representation matter in that way. And then I have a client currently that perfect example. Their parent called me. There is an adolescent. Their parent called and said they've been to therapy twice for 6 months
Okay.
at a time, and they were fully mute. Like didn't talk to the providers at all. So I was like, on the consult, I said, so how am I going to help them? And they said, well, we want to try. Well,
Mm-hmm.
one, because you're black and she's black and we just want to see.
Mm-hmm.
And she's been with me now for 6 months and
Mm-hmm.
is actually talking. And recently she told
Mm-hmm.
her parent that I'm able to communicate with you through her, as in through me, because
Wow.
it's like bridging the gap. So,
Right.
and then I talked to the parent separately, and they were like, yeah, I think that's what it was, because the previous clinicians didn't look like you and speak her language and get
Mm-hmm.
down to her level, that she just didn't say anything in session. So that's a perfect example to me of why representation matters.
Right. Can I have somebody drop subject matter expert stickers in my chat, please? Dr. Martha, I want to hear from you. I'll repeat the question for you, okay? Why is representation among mental health professionals important for patient engagement and outcomes overall?
I'm going to tie it back to education again, if you guys don't
Yes.
mind.
Yes.
But representation builds trust, and not
Okay.
just with our mental health therapists, but back to school, teachers, right? We have more teachers now that look like us growing up that may not have been our experience. So think about how difficult it was to make that connection with your teacher when you were school aged. So
Mm-hmm.
again, moving forward, when individuals see providers that look like them or maybe have a shared experience, whether it's culturally or maybe language, they're often more comfortable expressing themselves
Right.
and advocating for themselves because now we've made a connection. What that connection is, whether it's language wise, cultural, maybe we're wearing the same sneakers, right? We both have J's on, like, okay, I connect
Mm-hmm.
with this therapist because, and we haven't had a conversation yet. We've only said hello to each other. But that was already enough for me to see a little bit of myself in that
Mm-hmm.
person. So that's going to allow me to open up.
Right. 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 Miss Krista, I want to come on over to you. How does having culturally competent providers impact trust, communication, and treatment success? Okay, we talked about why representation is important. Let's get into the treatment success. How does
Uh,
having culturally competent providers impact the trust, the communication, and the treatment success?
because if you meet a client where they are and have already gathered all of this information about who they are, what their values are,
Mm-hmm.
you're going to then tailor a treatment plan to what they want to work on,
Mm-hmm.
not what maybe the referral said, not maybe what their parents said or what the court said, whomever said, you need to go to therapy. It's
Right.
more so, what do you want to work on when you're in this space?
Right.
And how do we get to a space that you feel confident and comfortable in? And so if I'm just throwing things at somebody and that doesn't align with their values, I lost them. They might not come back. They might feel offended. They might feel invalidated. And so when we're able to recognize that, even if I don't have the same spiritual beliefs as a person, I'm going to use their spirituality and the way that works for them if that's important to them, not telling them, oh, you need to do this.
Mm-hmm.
Right.
Mm-hmm.
And so it really is about having an understanding of how their cultural traditions and values impact their overall well being. And then how can you use that as strengths to get them along to what they want to work on, not
Right.
what
Right.
society is telling them they need to do.
Exactly. Okay, I see you. Anybody else want to add before I want to head back over to Dr. Michelle. We good? We can continue. The coast is clear.
Can I say one
Yes, you
thing?
can. Yes, you
So
can.
you use the word cultural competence, right? Or
Mm-hmm.
but and I think Crystal mentioned it earlier too, but the way that where we really want to be in the middle is cultural humility. And that's everything that she touched on was it's actually cultural
Mm-hmm.
humility. Sorry.
Mm-hmm. I hear you. I see. That's why you're here, ma'am. That's why you're on this panel. Dr. Michelle, it's almost 8:30. Can you just answer this last question first, and I'm gonna drop you down, okay? We're good on time? Okay. What advice would you offer to BIPOC students and emerging professionals interested in a career within behavioral health?
Definitely do your research. Therapy is very popular right now, which is great. That's a really good thing. A lot of people are becoming clinicians or even being interested in seeking a therapist. But if you are a student and you're thinking about this career, do your research. It's we take on a lot of people's trauma, and you have to know how to separate that from your personal life. I've seen a lot of clinicians burn out, my interns included, and I have to teach them that this is how you separate it. If it's becoming too much, this is what you have to do. So if you have to have that mindset that, yes, I'm here to help these individuals. However, that's not your burden to take on in your personal life, and everybody don't know how to separate that. So I would really, really say do your research. Do if you have the opportunity to watch videos, because sometimes people do record sessions and so on. Also go to support groups, because that can show you how the facilitator does the therapeutic interventions and so on. So I would say don't just jump in it because the name sounds good or the profession looks good or the money looks good, because a lot of therapists nowadays are talking about how much money they're making. That's fine. But it's more to it than that. You have to make sure that you have the capacity to actually do this work, because it's not easy. Like, we might make it look easy, but it's not. So definitely ensure that you're mentally prepared to do it, and to take on what you're learning from individuals, because the worst thing is to go into a field or a career, any career field, and cause more harm than good. And a lot of our people that we see are already harmed. So we have to be the voice for them.
Exactly. Dr. Michelle, I know you have to go now, but my last question I always ask my guests, but can you, before I drop you down, can you share your overall why? Why do you continue to show up? Why do you continue to open the doors to your clinic? Why do you continue to serve the patients that you do? Before I drop you down, you have to answer that. You answered it recently, but I hope it's been updated and upgraded. What is Dr.
Because
Michelle's overall why?
my why is, it started because I wanted somebody like me when I was an adolescent, and I didn't have that. So being able to have people in my practice to come to me so that they can share how they're feeling, things that you wish you could talk to your parents about, and so on. But my why has changed, actually, recently.
Okay.
I'm going through something very personal medically that I will share in the future. Not yet. But because of that, I do, after I'm over this situation, I do want to be more open about women's health issues and so on, and how that impacts us, and how we still have to show up every day to work, and we're going through so much. So I will come back another time to talk about that once I'm ready, but and I will definitely share that why. But yeah, the good thing about our whys is we can always evolve.
We can always evolve. I love it. Well, Dr. Michelle, thank you so much for the work that you do. Thank you so much for taking the time to step into this panel and drop some gems. I appreciate you as always. Continue to show up and continue to be great. Can I have some round of applause for Dr. Michelle in the chat? She has to go. She's leaving, but we're not done yet. We're almost done, but we're not done yet. Can I have a couple round of applause in the chat for Dr. Michelle?
Thank you. Happy to meet with all of you, and I hope we can all connect.
Definitely. I appreciate you. I want to hear from Dr. J, okay? We're getting into the section of mental health maintenance and prevention, okay? And as we wrap up, I can have all of you guys, touch on this and, share your acquired experience on it. We often talk about mental health wellness when someone is struggling, okay? What does maintaining good mental health look like before a crisis occurs? Dr. J, what would you say? Let me hear from you.
So before something actually comes up, what does it look like? So it's going to look different to everybody, but it's all those different types of interventions. Some of them were mentioned earlier. So doing those things like to move your body. So maybe if you move and something happens, you don't need as much time with Dr. T if something happens. Things like making sure that you pay attention to the quality of your thoughts and what you're telling yourself, and what you allow other people to say to and over you as well. And then some of those, just like those typical types of practices like meditation, breath work is free. It's accessible to all of us. And making sure that you're regulating your nervous system, helping to calm your mind on a consistent basis so that when a crisis does come up, you don't go from 0 to 100. So those are just a couple of things, but those kind of things, just those daily practices, whatever your daily habits are, that's who you are, and that's how you're going to show up in a crisis.
Right, I love it. She nailed it. Dr. Martha, Miss Crystal, she's good. We can continue. We good?
Yeah, she's great.
Okay.
I was
Okay.
gonna
So
ask Dr. J.
okay,
And
Doc.
she's great too.
Can I add something to that that I have noticed with my patients?
Sure, sure. I'm coming to you
Is
next though. So just know I'm coming to you next. Okay.
is also their support system, the people that they have around.
Hmm.
I noticed that some people may be mentally working with a counselor, but then whether it's their provider or their family, and they say, "Oh well, you're not going to be able to do that. Are you sure you can?" It's like they're doing this work in mental health, and then their community is either not necessarily poking fun at it, but it's almost like, well, they ain't what the doctor said. Oh, they ain't said it. So I saw so and so back in the day not doing it. That you sure? So it also kind of brings that doubt. So I think your community matters. The people that you're around also matters, because you can be doing all the work and they just plant a seed, and that seed just slowly grows, and then it's like your community versus your mental health therapist. So I have seen that in therapies. Sorry, Dr. J, I wanted to add that too.
No, because the
No.
seed that your support system plants is either going to grow into a weed or it will grow into a beautiful flower. So you got to be
Hmm.
careful with that support system. Thanks for saying that.
Thank you. Dr. T, I'm coming back over to you, okay? What role does sleep, nutrition, exercise, mindfulness, spirituality, social connection, and community? You see why I asked you, the health hub with Dr. T?
Because
I'll start right because it's all of it. What role does sleep, nutrition, exercise, mindfulness, spirituality, social connection, and community support play in overall mental wellness?
I mean, it's huge. If you
Hmm.
don't sleep, guess what? You're more irritable. You're not able to process. Your muscles aren't relaxed. Your brain isn't relaxed. You're
Hmm.
already worked up. So by the time you wake up because you didn't really sleep, you're still trying to catch on. And your anxiety was already here, and you're probably even higher up more. Your muscles are still tense. Your heart rate, your blood pressure is still up,
Right.
right? If we look at nutrition, what you eat matters. If you're not eating the right things and your blood sugar is high, you really can't sleep either. And then
Hmm.
guess what? You're running on that momentum because you're not allowing your body to break down the way it's supposed to. So all those things matter, right? We look at how we have diabetes. Yes, it's what we eat, but that lack of sleep plays a role into it too. There's so much that is connected. Your wellness, your social, everything plays a big role. We're never going to be balanced. I haven't seen it, and I know that I am not. But the goal is to train our bodies in every single part of it. I didn't say try to be balanced. Is to train our bodies, what we eat, how many hours of sleep we're getting, what we're doing socially, what we're doing not so. Like, we have to train our minds. We have to be mindful. There's art in something, I forget her full name on here. She does rest and mindfulness, and she says just do 2 to 3 minutes a day of just sitting with your thoughts and just relax. Maybe not even think about anything. She said that can go a long way. So all of it plays a role. You have to be able to pick a little bit of it, because that's what makes us whole. We're
Right.
not all spiritual. We're not all, but we have components of each parts of it. And that's what kind of brings us together. Not sure if I answered your question. If I didn't.
Yes, you did. Thank you. I wanna highlight Coach Jen in the chat. She said also for us to please note that this awareness month was founded by the late BB Moore Campbell. That's why we have the BIPOC Mental Health Awareness Month. Okay, Coach Jen, I see you. I appreciate you for being here. Thank you so much for stopping by. Dr. Keisha Davis, I see you. Thank you so much for being here. Dr. Keisha said, and you have to learn to accept the things beyond your control, like neurological disorders. Hello. Hello. Let's continue because I've held you guys for about an hour and a half, and I appreciate you guys all for being here. So we're gonna wrap this up. As you guys know, I always ask my guests their overall why and the reason they continue to show up. We'll start in the middle. Dr. J, what is your overall why as it relates to the work that you do and the reason why you show up?
So it's similar to Dr. Michelle. What she said is that I didn't see me represented here. And growing up as a teen, I didn't like the way that certain people were treated around mental health in high school. And so I said I would join this field. And going even deeper, there are so very few, if I just tease out um, my part of the mental health field, which is psychologists. There's very few psychologists of color and very few that look like me. It's gone up maybe 1% since I've been in the field. And then when we talk about neuropsychology, it is so thin, so small, so little. And so I joined this. My why is so that people can know that it is okay to get neurotherapy. Nothing against medication. Medication is a big part of a lot of people's overall wellness plan. And sometimes I even recommend it, but sometimes maybe our kids don't need the medication. Maybe neurotherapy might help there too. So that's a big part of my why.
Exactly. Thank you so much for sharing that, Miss Crystal. I want to hear from you. What is Miss Crystal's overall why and the reason why she continues to show up?
My why is also evolving.
Mm-hmm.
But at the core, it's being able to show up for people when they've been failed,
Mm-hmm.
and giving a space for people to feel seen, giving people a space to feel validated, and offering the healing journey that maybe they didn't have before, because we are all deserving of that. And I
Mm-hmm.
want to destigmatize and decolonize this field, and really shift us into generational healing.
Right.
And that is evolving, as I'm actively grieving the loss of my mom, who passed in
Mm-hmm.
May.
Mm-hmm.
And so I'm feeling more connected with grief, and I've always loved grief work.
Mm-hmm.
But why I still show up is to make her proud and
Mm-hmm.
to continue to shift the view of the generations after,
Right.
because she really did change her mindset around therapy. And
Mm-hmm.
I know that there's a lot of people above me in generation that still says it doesn't make sense. And so I still want to be here to be able to like be the light for my kid,
Right.
advocate for other people, and make sure that we have a safe space.
Right. Right. Miss Crystal, thank you so much for sharing that. And thank you so much for being vulnerable and sharing that. Dr. T, I want to hear from you. What is your overall why and the reason you continue to show up?
I've been thinking about that since you asked Dr. Michelle. I was like, what is my why today? And the
Mm-hmm.
thing that keeps coming to me is why not?
Okay.
Why not? I have breath in my lungs. I
Mm-hmm.
have capabilities. I have the knowledge. Why
Mm-hmm.
not? I was made for a purpose on purpose. And I was given all this for a purpose. And it's not to keep it to myself. I answer to someone who at the end of the day would say, what did you do with the gifts that I've given you?
Mm-hmm.
And so I got to use my gifts. I
Right.
may not know exactly where it's going, but this is a gift. And so I'm using it. So today, my why is why not? Don't ask me in 2 hours. It might be a whole dissertation in 2 hours, but
Mm-hmm.
nothing deep, just why not?
I love that. Thank you so much. And Dr. Martha, what is your overall why? What is the reason you continue to show up and do the work you do?
I think, like everyone here, it goes back to my passion. You know,
Mm-hmm.
our past experiences lead our passion. And
Mm-hmm.
I think, based on what I've seen from all of you here today, it sounds like our experiences have shaped why we have chosen careers in the mental health field, right? Or the mental wellness field, like I like to say. I'm especially interested currently in helping families, school leaders, teachers, therapists, in creating this interdisciplinary community where we could all share research, tools, knowledge, evidence based practices that could possibly help address a lot of the issues that we're seeing, not only in the community of color, but just in the communities in general. So I think I'm particularly interested right now in the gut-brain connection. It is what I focus on my lives. And just seeing how overall sleep and nutrition could either exacerbate or improve a lot of these traits or deficits related to autism and ADHD and sensory processing differences. So I think my why is to share information, share research, and hopefully out of 10 people that, get something from my lives, they could share that information with 10 other people. And then those 10 people could share it with 10 others. And my goal here is to start a movement so that we can continue paying it forward with this information that a lot of our community members don't have access to.
Exactly. Thank you so much for sharing that. You guys did amazing today. Shout out to, can I have some round of applause in the chat? Can I have some round of applause in the chat for my panel today? This was good. I was excited for this one. I'm always excited for my mental health professionals because within the Black and brown community, it it's still an issue. Let's keep it a buck. It is still an issue. So thank you so much, you guys, for agreeing to this panel. Thank you so much for dropping your gems and sharing your acquired professional and lived experiences overall. Before I drop you guys each down, where can the chat see more of you? Miss Crystal, take it away. Do you go live? What is your schedule? What does Miss Crystal have going on?
Yeah, so I just started doing pop-up lives again, and I am going to come out with a schedule soon. And my lives are centered around mental health check-ins, integrating poetry with healing, talking about some of these different topics, and trying to just give education to folks around therapy, how to get it. And I do have a private practice, so I have a website where I could be reached. I'm here on this platform and some other ones that we can't say on here because we let a TikTok shop. And along with my recent release of my poetry book called Existing Healing Through Poetic Expression, that was released on Juneteenth, by the way.
Okay.
I am actively working on a workbook to go coincide with it. So anybody who's already purchased it is going to receive that digital workbook. And I'm going to continue having, I want to start integrating that also into my lives and having discussions about those pieces.
I love
Thank
that.
you.
Well, once again, Miss Crystal, thank you so much for being here. Continue to show up, ma'am, and continue to be great. Let me drop you down. Dr. J, where can we see more of you? Do you go live? I know you go live.
I go live. I did take a live break. I had thought I would be back at the beginning of July and had a couple health things. And I always say life before lives. So I took care of myself and I'm feeling better. And so I will be back soon. You're my first debut since the hiatus. So here with all of you ladies. So I do have a live schedule. Some of it is posted already on there. I have Mental Health Monday. I have therapy. Like where I talk about a breakdown, kind of like Dr. P, break down different things with the brain on Thursdays, and on the weekends we sound. So I do sound healing, sound therapy, sound things to help people with re-regulate their brain. And then like Crystal, I also have my own practice and my own website, which is my name, just drkatherinejackson.com. And I do show up on other platforms. We won't list them because TikTok, we're just thankful for them. And I have other projects coming out towards the end of the year and beginning of 2027, books and other products too.
Amazing. I love that. Well, Dr. J, thank you so much for the work that you do. Let me drop you down. Continue to show up and continue to be great. Dr. Martha, where else? I know where we could find you, but where can my chat find you? You guys, Dr. Martha's lives are engaging and amazing. Dr. J's lives are engaging and amazing. Miss Crystal is a yapper. And I love to just sit there and just hear somebody yapping about a whole bunch of good stuff. Dr. Martha, where can we find more of you?
And then there were 3, right? So I'll go live 3 days a week currently, Monday through Wednesday. I typically say 8:30 p.m., but it's summertime, so I go on a little later now. I will be on live in the next 10 minutes. So I am on from 9 p.m., depending on how engaging the chat is, to like midnight sometimes. If I have some people that are, reaching out from the West Coast, then I stay on till 12:30 a.m. sometimes. So I usually just base it on the engagement of my audience. I do currently discuss mainly autism and ADHD support, but I do try to share like anything related to neurodiversity. So tools, research, evidence-based practices, how to address, again, these deficits holistically.
Right.
Nothing against medication. But what I always tell my community is, have we explored other interventions, other
Right.
options before looking into medication? And if the
Right.
answer is no, then maybe that's where we should start. Maybe we
Right.
should start by simply making some adjustments to your diet and see how that impacts your day-to-day, right, health. Just like everyone else, I do have my own business. It is Dr. P Learning Solutions. So I provide ongoing coaching, executive functioning coaching. I provide, professional development services. So speaking of training, if you guys know anybody who needs training on, just supporting neurodivergent individuals, that is my area. And let's see what else. Oh, and IEP advocacy services. So I help
Okay.
families advocate for their child's rights, and whatever that looks like. And yes, I do have some projects that I'm working on currently. I've been working on developing a course for quite a few months now. It is much more extensive than I thought it would be before I got into it, but nonetheless, I am working, chipping away at the paint. I'm almost there. And yeah, so anytime you guys want to find me, just log on to your TikTok late at night and I should be on there. But thank you guys so much for the support. Thank you, Dr. J, for inviting me on here and helping me with these beautifully intelligent and just culturally responsive therapists.
Thank you so much. Thank you so much, Dr. Martha. Let me drop you down. Continue to show up and continue to be great.
Bye. Thank you.
Okay, now Dr. T, the health hubber, Dr. T, what is your overall why? Why do you continue to show up? Mute.
Me talking. I'm still on why not. I have people like you in my corner, people that egg me on. I have the resources, I have the connections, I have a little bit of knowledge, but I know the people that know the knowledge. And so I have a duty to continue to show up. As long as I'm healthy and I'm whole, I will show up.
I appreciate that. I appreciate that, Dr. T. Oh, Dr. Martha, Dr. Martha, I'm in Florida too. I'm in Miami.
Look at that.
Oh, I didn't know Dr. Martha was in Florida.
Look at Dr. J say, okay now, Dr. T.
Dr. T, once again, thank you so much for the great work that you do. Thank you so much for always showing up, Dr. T, and thank you so much for the consistency. The people who I bring on my panels, I've been in Dr. Martha's lives. I see her consistency. I see your consistency. I see my official yapper, Miss Crystal. I see Dr. Michelle. I see who else I had on here? I forgot. It was a lot. It was a packed panel.
Right.
Who am I missing?
Dr. P.
Dr. J. Dr. J can put me to. I could put my phone on the pillow, and Dr. J will put me straight to sleep. So I see the consistency, and I see the work that you guys put in. You guys are amazing. So once again, thank you so much for just showing up. Okay, thank you so much for showing up. I appreciate you.
Absolutely. Before you drop me down, can I take over your panel really quickly?
Sure, do what you got.
All right, y'all. I want us to appreciate Dr. Johnson.
Oh Lord.
It takes a lot of work to do what he does. To show up, to bring a panel together, to organize it, to make it where people learn and people can connect. Please drop his stickers in the chat. If you have any roses, even if it's one roses, drop some roses for him. Give him his flowers while he's here. I know he's hungry. That's why I'm gonna keep it on here because he's hungry. He's ready to eat. Your moderator said he's hungry, but we gotta appreciate you because sometimes we just don't. We take it for granted. We take it for granted that, somebody's doing this work and we don't see the work, right? Success is built in the unseen hours and you deserve it. You
I
deserve to be
appreciate you.
appreciated. You deserve that every week you show up, you bring subject matter experts, you come in, you interview us, you make sure that we're right for the people. And it takes a skill, and you are skilled. And I'm going to ask you, what is your why? Because I'm gonna get you on my panel. But today, we've all said our why, but what is your why? Because your why is very important.
My why, I've shared it before briefly. My why is being the Dr. J I never had.
Mm,
Growing up, I didn't have somebody who worked in healthcare administration, who was juggling multiple jobs within healthcare, who was teaching. I didn't have somebody doing what I'm doing now. So you see, when I tell you guys, continue to show up, continue to be great. I never had somebody. I did have the support of family and friends, yes, but professionally, I didn't have nobody to tell me, I see you. I see
mm.
the consistency. Continue to show up. Continue to be great. And one of my moderators, El Meek, made that sticker because I truly said that to my people online and even offline. Continue to show up, continue to be great. So, in a nutshell, my why is be the Dr. J I never had.
Oh, that's awesome. Y'all put I see you in the chat. Say I see you. I see you. Thank you for all that you do. On behalf of
Thank
every
you.
single person that has been on this panel, I can confidently, not knowing them, but I can speak for them and say thank you. Thank you for all that you do. Thank you for showing up. Thank you for being great. Thank you for encouraging even outside of
Okay,
us.
now.
Thank you. We appreciate you. And then I want to see you on the Health Hub with Dr. T though. When we gonna have
Yes,
that?
we're gonna have it real soon. But guess what? You guys, she Dr. T is also my scheduling manager. So there's a couple people in this chat who Dr. T is trying to book to come on over to office
They
hours with
booked.
Dr.
Don't worry about
Jackson.
it. They booked. They booked.
Okay,
They
I don't
booked.
want to
They
put
know who they
nobody on
are.
the spot. Yeah, I'm not putting nobody on the spot, but there's a couple people in this chat too who Dr. T is trying to book to come on over to office hours with Dr. J. My moderator says it's time for me to go eat. I appreciate you guys so much. Dr. T, you're amazing. Continue to
I see
show
you
up.
later.
Continue to be great. I'll see you later.
Thank you.
Deuces in the chat. Can I have some deuces in the chat? We gotta go. We wrapping it up. It's 8:51. We wrapping it up. Something you could use. I appreciate you. I appreciate you, El Meek. I appreciate you, Pals. I appreciate you, Miss Mika. I appreciate you, Aaron Turner. I appreciate you. I just shouted out all my moderators. Miss Crystal, I see you. I appreciate you, Lady Red. I see you. Her Divine Alchemy. I see you. I gotta go. I'm tapping out. Dr. J, I see you. Habisha, the therapist. I see you. We gotta go. Dr. PD. I see you. Miss El Meek, I see you. I gotta go. Okay, it's dinner time. Dr. Fleeta, I see you. I'm gonna connect with you. And I think Dr. Keisha, I'm gonna connect with you as well too. I gotta go, y'all. I gotta go. If I don't hang up, I'm gonna stay on here.